Welcome back to Drrodrohrich Knows Podcast, helping you become a better and more informed and educated you. So let's talk today about a current fad or trend in plastic surgery. Are women choosing smaller implants today? Well, let's find out. Let's find out why and if this is truly a reality. Is there a global shift towards natural beauty and perhaps more proportionality? Well, it's really a discussion that every one of us has with our patients when they're thinking about having breast enhancement. And of course, a natural and balanced look is not an aesthetic trend. It's really what should always be done. The overdone look, I think, should always be out. And people really need to focus on subtle enhancement. But is it really a trend today around the country and the world? Are we transitioning from this full look to something that's a more smaller and more perhaps proportional look after surgery? And I've discussed this before with my good friend, Dr. David Hildago in New York, about some of the breast truths. And, is this really what's happening around the country? Or is it because of the influence of stars that not only had big implants and then took them out and now they're saying, oh, we don't want that? So let's take a look at that. And is smaller better? Does it reduce tissue stress, lower incidence of capsular contracture, and the longevity? Do all these matter? And is this truly something that's a trend? Or are we replacing implants and adding fat transfer to give a more natural look? What is really happening here? And this is a patient that had such a thing with implants and then the addition of fat to give them a more natural, more full, and more pleasing look. And really, I think, is it the influence of fitness and the wellness culture that people want to be more active and small sizes align with the modern body ideals? So we've discussed this a lot on Hey Doc, and to be honest, with Dr. Bill Adams and many different world experts in cosmetic surgery. And I think it's a cultural and regional difference. In North America, the trend has been to a smaller, more natural look, but I will tell you, it's more regional than that. In the North, smaller look has been more natural for a long time. In the South, certainly in Texas and in Florida and California, the look has always been a fuller, perhaps natural, but it's certainly a larger look. In Europe, it's more or less been minimalist. And certainly in Asia and Korea and Japan, it's been more petite. Latin America, moderate. I think the swing is from moderate to large. But in the U.S., I can say that it's really trending based upon the region of the country. And certainly in Dallas, I think the look has gotten to be a little bit smaller, but not as small as what's in the Northeast. But I think the most important thing is that patients want to assure confidence, not just correction. They want to look more like themselves. And I think the surgeon's obligation is to guide them towards realistic age proportionality so that when you do breast implants, you know what looks good on you and actually will age well with you. And it's really not about the size. It's about symmetry, proportionality, and sustainability. So this new era of breast aesthetics emphasizes balance and longevity over exaggeration. And I think that's a good thing because I think the larger the breast implant, the more potential for bottoming out, capsular incidence of changes, and the need for revisional surgery long term. I really think that certainly if you're going higher than 350 to 400, your incidence of having problems and sagging out do increase. But there are regional, international differences, and that's just the fact of life. So the take-home message here is that breast implants may be trending to be smaller around the world, which I think is a good thing. But I think we're probably listening more to our patients and saying, hey, what do I want to look like? Not now, but in 5 and 10 years from now. I think it's good. Not smaller, but more proportional is probably the most important thing to aim for. And doing what's good for the patient, being guided by a board-certified plastic surgeon that has experience and expertise in breast surgery and breast augmentation. Give us your thoughts, give us your comments, see what you think about what type of implants you may consider or questions you may have. And please like and subscribe to Drrodrohrich Knows Podcast Best and follow me on my YouTube channel.